My name is Carlson. Today I'll be giving a speech about healthcare disparities. So, what are health disparities? So, the CDC's definition for health disparities are preventable differences in the burden of disease, injury, violence, or opportunities. The categories for at-risk people are race, gender, education, income, disability, and where they live. Impacts in health disparities cause. Health disparity can cause many fortunate side effects. Some of those side effects are a higher mortality rate, more medical debt, as well as a worse patient experience. So recently, China's had a major healthcare reformation. So some of the most notable achievements that they achieved in that is that the number of people that had an emergency and decided not to go to a doctor went from 12% down to 6%. There were also numerous achievements in ward beds per 1,000 people. The infant mortality rate decreased and the average spend increased, which went above some medium and high income countries. China's bioethics research teams have continued growing, and a batch of bioethics professionals have had new findings promoting this reform's fairness and justice. So this is absolutely massive for China. They have a very large population, and taking these steps will help them in the long run. So what causes health disparities? So the healthcare industry here in America is normally places profit over patients. This causes many health disparities. For example, location. So when you're in the city, there's a lot of patients that'll come in. They'll come in more often. There'll be ambulances that'll take them, and hospitals and clinics will be much more profitable there. However, when you go a couple hours outside the city into, like, let's say Virginia or Cook here in Minnesota, then there's not as many people that'll be having to go to the hospital. It won't have as much profit. There won't be as many ambulances, and the healthcare industry there won't be as profitable. This causes there to be a lower emphasis on the hospitals and lower quality of doctors in those rural areas. And there's the unfortunate correlation between race and negative health, and I guess race and health disparities. So people of color on average make less than white and Asian Americans. And because of that, they have less access to care. They can't afford as good insurance. So they have a higher chance of going into medical debt. They might not be able to afford as good treatment. And then there's also bigotry and racism that can affect them. Sorry about that. Causes health disparities during care. I just talked a little bit about that. There's racism, there's homophobia, there's sexism, there's ageism. There's also, like, obesity is a big one that sometimes doctors will chalk symptoms up to just them simply being obese. And then this is my first reference slide. And this is my final reference slide. Thank you for listening to my presentation. Have a great day.